Hey everyone, welcome back to the channel. If you're new, my name is Tish and I'm continuing my journey to become a Hyster sister. My purpose for sharing my journey is to let others know what to expect during their journey. Now, I do realize that everybody's journey is different. So this is my journey and maybe you can learn something from what I'm going through or what I'm about to go through. So today is all about the pre-op appointment. I'm going to go over everything the doctor covered with me during this appointment, as well as the questions that I asked my doctor and the answers that I received. So the doctor's office called me the morning of my pre-op visit to let me know that my doctor had written a prescription. So when I asked them, like, what did he order? What type of prescription did he send over to the pharmacy? She was like, well, he'll cover all of that during your visit today. In my head, I'm thinking he ordered I think it's like the pre-surgery Ensure, the stuff that you drink before you have surgery to give you energy or whatever after surgery. I thought that's what it was. I was up here racking my brain trying to figure it out, but y'all, I waited about 2 hours after that phone call. I pulled up the pharmacy on my app and I saw the medication that he ordered. And I'm looking like, I'm confused. Like, is this something wrong with me that y'all are not telling? I mean, I had 1,000 thoughts going through my head when I pulled up that app. I'm like, why are you ordering this medicine? Like, what is wrong with me? So fast forward, I went on to the appointment. And since I remember that she said that he was going to go over the medication during the appointment, you know I couldn't wait to ask him, like, why are you ordering this medicine? Once I arrived to the doctor's office, this is where I filled out all of the paperwork and I had to pay the doctor's fee or the surgeon's fee. And with my insurance, since we've met our deductible, the surgeon's fee really wasn't that much. We just, paid it out of pocket. It wasn't that expensive. Now, them facility charges, that is a whole nother story for another day. So once I got to the appointment, filled out the paperwork, paid my surgeon's fee, and sat down. So eventually they called me to the back. She took my weight, and I noticed I gained like 2 pounds in a week. And I'm like, what is really going on? Gained 2 pounds. She took my blood pressure, normal. Everything is fine. So she put me in the room. And eventually the doctor came walking in with his Levi's and his polo shirt with his N95 mask. Came in, had a piece of paper in his hand. He was like, and he was writing everything. As he was talking, he was writing everything down to give to me after the appointment to let me know what I need to do to prepare for this surgery. Y'all could have blew me over with a feather. When he said, okay, keep in mind, my surgery is Monday. He said, Saturday, 8 a.m., he wants me to drink this stuff called magnesium citrate. Y'all, I used to work in the emergency room. I know exactly what this stuff can do to your system. So he wants me to drink that at 8 a.m. Saturday morning. But this is the kicker. I cannot eat anything for 24 hours. Nothing. I cannot eat anything. He put me on a liquid diet. So y'all, for 24 hours, I don't know what I'm gonna do with myself. And I know it's a mental thing. It's going to be mental. So between that toilet, I don't know if I'm gonna have time to even think about food, because I might not even have time to eat, drinking a whole bottle of that stuff. But I'm gonna have to figure something out. I'm gonna have to figure it out fast. And right now I'm trying to hype myself up. Now I know I can do it. At least I hope I can. I'm gonna try not to eat anything. Just keep it straight liquids. And I'll show y'all everything that I plan on eating, which is probably not much. Well, I can't eat anything, so I'm gonna show y'all everything I plan on drinking that day to help me through those 24 hours. So he told me to do that Saturday. Sunday, he says to get a second bottle of the magnesium citrate and to drink a half bottle of this stuff. Now, I'm almost positive that full bottle is going to clean me straight out. But he wants me to drink a half bottle of this stuff. But he said Sunday I can actually eat food. I'll actually be able to eat regular food Sunday. So that's a good thing. And the purpose of cleaning out my system is called a bowel prep. So I guess they want everything to be clean. It will help him to see everything he needs to see once he go up in there. So whatever it takes to help him get to whatever it is he needs to get to, I'm doing it. I'm going to do it. So I mentioned a while back that he ordered this medication. So this is the point where I'm asking him about this medicine. Like, why are you ordering this medicine? So he told me that because I do have the rapid heartbeat. Okay, so the medicine that he ordered is metoprolol. And he says the reason why he ordered it is because I have a rapid heartbeat, which it doesn't really race off that much. It hadn't did that in years. But he said he don't want to take any chances, so he ordered a slow release version of metoprolol. And so I'm taking that for 14 days. I started that like 2 days ago. So he wants me to take it all the way up. Well, he wants me to take it all 14 days of it. So take it before the surgery and after surgery. He says that it should help me during the surgery. So I'm like, whatever it is I need to do to not go into cardiac arrest while I'm having surgery, I will do it. So that's where I'm at now. I'm taking this medicine, and that eased my nerves a little, just a little. I was apprehensive about taking. I'm like, when I read, I'm like, this is a blood pressure pill. I'm like, my blood pressure is already normal. It's like normal to low. And if I take this blood pressure pill, will I mean, it's not a blood pressure pill. It's like for your heart rate. Like, but it does control your blood pressure. I'm like, if I take this thing, will it lower my blood pressure even further? And I mean, so far nothing. I mean, I don't feel anything. It does make me sleepy a little bit, but other than that, I'm fine. It doesn't really affect me that much. So I had to trust him. I had to trust him. So what were some of the questions that I asked my doctor, and what were the answers that he gave me? So the first question was, because I do remember my first visit with him, he said that he does not do bikini cuts. He does not do those hip to hip cuts. So I'm like, well, since you don't do those type of cuts, and what if my uterus is so big to where you can't get it out of the, pull it out of the tube or whatever it is you're going to pull it out of, what are you going to do? So he said he was going to cut an incision in the middle of my stomach. He said it's going to be about this big. And he said that he'll pull it out through that incision, and he's going to put it inside of a surgical bag and haul it off to the lab. So that made me feel better, because I'm like, I don't know what I'm going to do if you don't do the hip to hip, and this thing is so big you can't get it out. But yeah, he said he'll be able to get it out. He's going to cut a small incision, and he's going to pull it out through that incision. So I was comforted with that. The next question I asked was, when will I be able to take a shower? And the answer to that is the next day. He told me not to remove the bandages. So what he does is he placed a huge bandage around those surgical incisions. So he was like, you can take a shower, just don't remove the bandages, because up under the bandages are going to be stitches. And I don't want to pull those stitches out too soon. The next question was, will I need a belly binder? And the answer to that is no. I bought one anyway. But he said you don't want to be squishing that area, especially after surgery. You do not want to be squishing all of that together. So he says no belly binder, but he will send me home with a hospital grade ice pack. So I'm going to have that for my belly. He also recommended, and this was included in that question, he also recommended that I get a heating pad. They send that home with the hospital, but since I already have one, I'm just going to use the one that I already have. But he says the heating pad is going to be for my back because of the gas pains. He said a lot of people complain of gas pains. He says to put that heating pad on my back, and that will help with the gas pains. Now, the pain medicine that he told me he was going to order is Tylenol with codeine. And I think he said Zithromax or something for nausea. It wasn't Zithromax. I can't remember what it was. But he's going to order pain medicine, and he's also going to order medicine for nausea. and he wants me to take it as needed. But he did say you do not want to get out of the pain medicine. Don't go too long, before taking the pain medicine, or else if you wait too long, it's going to be too late and you're going to be in pain, and it's going to take a while for that medicine to kick in. So I have to be on a schedule until I can feel that I don't need it, which I'm not a pain pill person anyway. The last time I had surgery, I think I took the pain pill, maybe two of them. I wasn't in that much pain with that type of surgery. Now, this is a whole nother ball game, so I don't know what to expect. So another question was, will I have to pee, poop, and fart before I get out? And the answer to that is yes. Not all of them. He says I do have to pee and I do have to fart before I get out of there. And he said that if I don't pee, then they're going to send me home with the catheter. And I don't want that. I don't want no catheter. I do not want that. So what he said he'll do is he's going to order apple juice, water. He's going to have me drinking all of these fluids, so I will be prepared to use the bathroom. So that's why he said even though I'm getting there at 5:30 in the morning, he said I'll probably get discharged around 2:30 or 3 o'clock that afternoon. And it's all based on how soon I can pee. So once I can do that, then I can go home. So I'm going to try my best to get some pee out. Because who does not want to go home with a catheter is me. Another thing is, this wasn't a question, this was just something he told me, that he have all of his patients to come back within 4 days of the surgery. So my surgery is Monday. He has me coming back Thursday, and that's only because I think it's a holiday or something coming up. He's not going to be in the office Friday. And he's going to check my incisions to see how they are healing. Hopefully they heal just fine. Thursday is when he'll tell me when I can with my husband. And he'll also tell me when I can drive and when I can go back to doing normal stuff. So that's the appointment I'm looking forward to. Just ready for it to be over with, y'all. I think was that all? I think those are all the questions. Oh, those are all the. Oh yeah, I did. I asked him about, am I going to keep my cervix, or does he plan on taking it? He says he plans on leaving it, and he said the reason why is because the cervix provides that foundation. When you take the cervix, you take away the foundation, and that's when you get all the prolapse and all of that. So I'm fine either way you take it, keep it. It doesn't matter to me. The main part is just get the uterus out. Just take it. I don't want it. Just take it away. I'm tired of it. And I'm sure it's tired of me. I talked to it last week because I thought for sure I was going to be going into that surgery room, passing all these baseball-sized blood clots. My uterus fooled me. It was like, I'm going to show you something. It actually started last week. And it will be over with by the time this surgery come around. So I'm happy about that. So it gave me one last hoorah before. I think my body knows something is happening, because it all the cramps, everything you can imagine that comes with adenomyosis, it happened, during this period. So my body knows something is getting ready to happen. So it was like, I'm gonna let you feel it one last time before you get rid of me. And it did. And Monday I will be saying good riddance. So yeah, I hope y'all are enjoying this journey so far. I'm going to keep filming these videos. I'm going to try to film surgery. Well, I don't know how much of surgery that I'm going to film. Now, once I come, I know I'll be able to film before I go to the surgery center and when I get to the house. So I'll get y'all some footage so y'all can see how I'm progressing after the surgery. So be sure to like, share, comment, and subscribe. And I hope y'all continue to follow me on this journey, because it is a journey. But I'll see y'all in the next video. Bye, everyone.